What is it and why should we care? Ebola, more formally known as the Ebola virus disease, is severe and often fatal in humans. It has a fatality rate ranging between 20 and 90%, with an average of 50%. The disease is brought about by infection of the Ebola virus, known to have 4 disease-causing species. According to the World Health Organization, the Ebola virus was first discovered in 1976 in 2 simultaneous outbreaks, one in Zara, Sudan, and the other in Yambuku, Democratic Republic of Congo. Its discovery near the Ebola River in Yambuku gave it its name. So how does the virus infect people? It is still unknown how a human is first infected by the Ebola virus. However, researchers hypothesize that direct contact with infected animals and their body fluids are the cause of human Ebola outbreaks. Fruit bats are believed to be the natural Ebola virus hosts. In an outbreak, Ebola is spread by human transmission chains driven by direct contact with Ebola-infected fluids. This is known as droplet transmission. This means a person can become infected if their open wounds or mucous membranes, such as eyes, nose, and mouth, come into contact with blood secretions or other body fluids infected with the virus. Sexual transmission of virus through semen has become a highlighted area in recent times and is still undergoing further investigation. What are the symptoms of the Ebola virus disease? Symptoms of EBD are similar to the onset of many other diseases such as influenza and malaria, and thus it is hard to detect EBD in the early stages. Symptoms include fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and unexplained bleeding or bruising. Why should we be concerned about EBD? The recent and ongoing outbreak of EBD in West Africa, having had 11,314 fatalities since March 2014, has demonstrated the devastation possible by the Ebola virus. Multiple West African countries and even non-West African countries such as Nigeria and USA have been affected, with the highest number of confirmed cases in Guinea, Liberia, and Sierra Leone. Yes, we live in a first world country, and yes, we have a well-developed healthcare system in Australia. However, this does not mean we are immune to EBD, and this doesn't mean that Ebola would never arrive in Australia. Globalization has increased the mobility of people, making it possible for infected persons to travel to first world countries such as Australia. Furthermore, as of yet, there are no licensed treatments specifically targeted at neutralizing or immunizing against the Ebola virus. The pressure in onus is now on researchers to develop treatments and vaccines for Ebola. Several vaccines are now being tested, out of which 2 stand as the most likely candidates, one developed by GlaxoSmith and the other developed by Newlink Genetics and Merck Vaccines USA. So what can we do about the Ebola virus disease? It is important that we, the general human population, gain awareness of Ebola and Ebola prevention methods to reduce our personal risk of contracting the disease. When traveling to or in an area affected by Ebola, the Centers for Disease Control and Prevention America suggests practicing careful hygiene, not handling non-personal items, avoiding funeral or burial rituals that involve the body of an Ebola infected, avoiding all contact with bats and non-human primates, avoiding facilities containing Ebola-infected patients, and avoiding sexual activity.